Thank you all to our panelists for accepting the invitation. This webinar is part of the next EUK lecture series. It is a Jean Monnet Center of Excellence project on the future of EU-UK relations. And we organized this webinar in partnership with the Institute of Humanities and Social Sciences of Queen Mary, University of London, and its COVID-19 working group, which is headed by Professor Mitzi Legas, who is with us and will be our discussant today. So I'm really glad to welcome our experts today. We have quite a wide range of expertise and maybe also national perspective. Our first expert is Louise van Schaik. She's the head of unit for European Union and Global Affairs at Clingendael, which is the Netherlands Institute for International Relations. Next to her global health expertise, she has also extensive experience and research expertise in the field of climate change and sustainable development. And you have extensively worked on EU's multilateral or EU's performance and participation in multilateral bodies, such as the World Health Organization, on which you have also contributed with an article for the Journal of European Integration that I have co-edited with Stella Laddy, my colleague at Queen Mary, University of London. And you have also co-authored this article with Remco van der Pas, and you were trying to analyze what has happened to WHO, but also to EU's participation in this specific body. Then we are very happy to welcome Remco van der Pas. He's a public health doctor and a global health researcher. He's a senior research associate fellow at Clingendael, but he has also a senior research fellow global health policy position at the Institute of Tropical Medicine in Antwerp, if I'm not mistaken. And you lecturer also in global health at the University of Maastricht. And in the past, you have actually also been medical coordinator for the NGO Médecins du Monde, or Médecins du Monde in Indonesia. And you've practiced medicine also with refugees and migrants in Rotterdam. I'm also very pleased to welcome Professor Anna Olscheiter. I hope I pronounce it correctly. You have a chair of political science with a focus on international politics. And that's at the TU Dresden. But you also, I think, chair the research group Governance for Global Health at the Social Science Research Center of Berlin. And I think you will be able also to give us a little bit some perspective on Germany's position within the European Union coordination. And of course, as announced, we also welcome Professor Valsamis Mitsilegas, Professor of European Criminal Law, Global Security, Deputy Dean for Global Engagement Europe at Queen Mary, University of London. And you have actually, I think, also next to the working group on COVID-19 work that you're doing at Queen Mary, you also had a special task force, I think, on the future of digital justice, which somehow is also linked to COVID-19. So when we convened this webinar, we were, I think it was a month ago, and we were talking a lot about coordination amongst EU member states. We had the perspective that the EU had done very well in the first wave of COVID, but that coordination of vaccination strategies, of protective and medical equipment was becoming a little bit more tense, with a lot of criticism that it was, or it is not going fast enough, apparently. Some have spoken about a renationalization and also distrust or mistrust across EU member states. And I think I'm going to turn to Louise Van Schaik to give you the floor and have your perspective on these questions. And of course, I mean, the whole context, and because we deal with next EU-UK and the future of EU-UK relations, we had also a lot of distrust, I think, between not only within EU member states, but also between the EU and the UK, which was also quite interesting in this vaccine or race to vaccination. So the floor is yours, Louise.
Thank you, Sarah, and thank you for inviting me, and a really pleasure again to work with you, as you've also worked at Klingendael in the past and we were colleagues, and it's always a pleasure, and also with a special issue for Journal of European Integration. I was happy to contribute also together with Remco, yeah, I always had the impression in the Netherlands I was just, one of the few people that had an interest in this EU and health and global health. And now, of course, the interest has quite expanded. I wanted to give just a very general kind of overview and point out a few issues for discussion. And then I think Remco might go into a bit more depth on some issues with regard to the global health discussions on where they are today. So first of all, I think it's important if you go back a little bit to the pre-corona era. It's a bit difficult to imagine nowadays, but at that time there was hardly any role for the EU in the field of health. And also, if you looked at opinion polls, health came out typically as an issue where EU citizens, so Dutch citizens or German citizens or UK citizens, if you like, saw really little of an added value. And you also see in the EU different health systems, different financing of health. Sometimes it's also decentralized, like in Germany at the Bundesländer. And it was not felt that there is very much a need to Europeanize this field. And also in the context of the World Health Organization, you saw that the health ministries are typically the least internationalized or Europeanized ministries. They didn't really see a lot of added value to coordinate their positions in the World Health Organization. Okay, if it would make them stronger to operate as a bloc, then yes. And okay, with the establishment of the European External Action Service and the EU delegation in Geneva having added some competencies and capacities also, there is really a stronger coordination to operate as a group, but there is also still this reluctance and also this suspicion, if you delegate this to the Commission, would the health interest of the countries, of the member states, still be guaranteed? So overall, let's say this field was not very Europeanized and also not very much a field where the EU operated strongly in concert in the World Health Organization or in the many other international organizations that somehow deal with health issues nowadays, and already for a while, because this is a very fragmented field, if you like. The World Health Organization was also among the international organizations that was really a bit neglected by the West. So that had to do with the funding, but also the intention for the organization. There was not really a very strong EU position on, what should be the core mandate of the organization. If the regional structure of the organization with its country offices and regional offices would still fit, the mandate and the tasks, how to deal with the many indeed philanthropy and other organizations that came up, the relations with big pharma. So there were some piecemeal positions on issues, of course, and there were also some negotiations on the international health regulations, on the Framework Convention on Tobacco Control, but it was not, something that carried really the high-level politicians. It was already remarkable if health ministers were interested, let alone, let's say, the prime ministers or foreign ministers. Of course, there were some EU policies in place also in the pre-corona era, but that had more to do with really cross-border issues, also tobacco control, because it was related to the internal market, policies to secure the rights of patients abroad, some recognition of health diplomas of medical staff. So there were some things in place, but it was really always very functional if it was related to the internal market. And only when some diseases were disease outbreaks were with animals, then there was, this recognition that might also be a One Health risk that it spreads to humans. And also the animal diseases made clear that joint purchasing might be a way to avoid, let's say, member states competing against each other. So there was some initial thinking about this pre-corona. And the other issue, of course, that also member states struggled a bit with how to keep the prices lower, because we know that big pharma always claims that they need a lot of funding to do research for new medicines, but they usually charge that on medicines for diseases which are not so common, and member states, were a bit struggling with how to deal with it. So then came COVID-19, and it was a bit shock and awe effect. And in the EU, you saw the first reaction was really what has been labeled corona nationalism. So all the member states looked after their own citizens. They took advice from their own national health institutes. They closed their borders. They were concerned about this protective gear. But quickly, it was also realized that these are perhaps things that you should do at the European level, simply because indeed, otherwise you're competing against your neighboring countries and your European brothers and sisters, if you like. So we saw that quickly Brussels started to, well, not maybe quickly, but after a certain point, Brussels got its act together and started to slowly coordinate matters. And most importantly, with regards to the vaccines, a system eventually was established to have joint advanced purchasing agreements with the big pharmaceuticals. So it was really the Commission that pushed for that, but it's negotiated by a team in which also some member states representatives participate these deals. We also saw that the Commission President Ursula von der Leyen calls at a certain point in September 2020 in her State of the Union speech, her annual speech on where the EU for a EU health union, so for an intensification of the policy. And she even in a way hints to perhaps the EU treaties in which this competence of the EU in different fields is specified, needed to be adjusted for the issue of health. At the same time, we saw a bit earlier in the summer that the EU leaders of the EU member states negotiated the new multi-annual financial framework, so the new 7 years budget for the EU, and they already slashed this budget for health. So the Commission proposed a huge increase of budget for health, and the member states said, well, we don't want the EU budget to be too big. And where did they make the cut with this increase of health funding? On the one hand, you see, let's say, an activistic commission. Also globally, pledging conferences were organized, and the EU also pushed for the establishment of the COVAX facility at the World Health Organization. So really to drive also vaccine provision at a global stage, because it is also in the EU realized that, okay, we care about the EU citizens, but we also realize that if there's no vaccines available in the rest of the world, we will not get rid of corona. Then indeed, you already alluded to it, Sarah, early 2021, we saw that the vaccination and approval of vaccines and the distribution of vaccines becoming available was a bit slow in compared to the UK and Israel. And we saw criticism emerging about the EU perhaps having handled this too bureaucratically, and also an open row with the AstraZeneca company about perhaps vaccines being produced in Europe being exported elsewhere, with the suggestion that it might be the UK, AstraZeneca being Swedish, British company. So that was all very salient, and we also saw a leak of the prices in which we saw that the EU had actually negotiated relatively hard on the prices, and also it seems to be that the EU had also negotiated a bit tough on the liability issue. So if there would be potential side effects of the vaccines, the risk would be more with the producer, not with the states, and perhaps other countries, but we don't know for sure because we don't know the contracts, for instance, by the UK with the pharmaceutical companies have negotiated maybe a bit less hard. And also in the UK and the US, we saw that there were pre-admissions of the medicines on the market. And with the EU, there really had to be an EMA, European Medicines Agency approval. So that's what happened. I think I'm already almost in my time, but I wanted to make just a few quick points. I also wanted to point out that the EU is also at the same time being, so it's accused for not having made the right deals and not having made tough enough provisions on the delivery of the vaccines to the European Union. At the same time, it's also accused by other countries in the world, together with other richer countries, that it has overpurchased for its own population to the detriment of developing countries. And we also see this pressure of this vaccine diplomacy. So China, Russia, India, using the vaccines perhaps to create new, allies internationally, and how should the EU respond to it? So I think for the discussion, there's two issues where I see really debates that might emerge, probably on many more topics, but that are topics that I think are very interesting. The first is, if the EU has over purchased, where are these supplies going to? The member states, it seems that the member states can decide themselves where they're going to whom they're going to give away their extra vaccines. So would it be the Western Balkans or the neighborhood policy, or perhaps former colonies of member states? And the other big question is, how are we going to go ahead with the World Health Organization? Now the US is also back in the game. Is the EU now still going to push for serious WHO reform? Or are we going to push through this pandemic treaty? What about the global health security agenda that kind of sidelined already the World Health Organization on the implementation of these international health regulations? And if we would not seriously, let's say, bolster, strengthen the World Health Organization, would you then have a risk that this becomes another UN agency where we will see a Chinese takeover? Question mark. Okay, I will leave it here because I think I took enough of my time, and I'm interested to hear your perspectives on these issues. Thank you, Sarah.
Yeah, thank you, Louise. I think you've been quite complete on the situation of the EU before and after Corona. What was missing also, or what is missing in terms of competencies, and how this is a very dynamic field where the EU there is a lot of blame avoidance, but we shouldn't forget the role of the member states as well, I think. We will come back to that later with maybe the contribution of Anna on Germany. But for the moment, you've raised a series of really important questions also from a global health security perspective. And I don't know, Remco, if you would like to reflect on the questions that Louise has raised, and also I think the issues of trust or mistrust across countries within WHO, but also between richer and, let's say, low and middle income countries. What's the situation from your perspective? The floor is yours.
Yes, thank you, Sarah. So for me, good public health measures improve legitimacy of governments. But in a globalized world, it's important that a lot of these global health risks, they are transnational. So to have a legitimate response, you need to organize yourself not only domestically but also within the European Union, and also then at the global level. This would now also, for instance, with the UK being out of the EU, it still matters that we collaborate on these transnational global health risks. So we need to find a new way for there. For me, and this is speaking from a public health background, this COVID pandemic is really like a magnifying glass of how things really are. and how we relate to each other, and how also we prioritize certain population groups to be protected against certain risks. One thing, so I work a lot also with HIV/AIDS researchers, and they are getting quite well reminded about the situation 20, 25 years ago, about how the world then dealt with the HIV/AIDS pandemic, how that became a security risk, how treatment was made available or not, and the debates about also patent rights, etc. So there is a kind of, although it was a very different pandemic from a viral perspective, it did trigger some old reactions, I would say, regarding how to deal with these issues. Now, so what amazed me in the Netherlands is how small we looked to things, and how we talk about our domestic capacity for testing, for research, for delivering vaccines, etc., and that 95% of the debate is with Dutch actors, but that we fail somehow to really do that in a more international perspective, and to realize that that we can be complementary vis-a-vis each other, also at a European level. But that's also because that's the way how the mandate of the EU works. Indeed, it remains a domestic mandate, and that's you also see that how the institutions react. So all my public health colleagues that are working at the Center for Disease Control in the Netherlands, that's where the discussion takes place as well. So also scientifically, there's much less exchange than I would have hoped to. It's also the institutional setup of such a public health regime. So what Louise has said is that there is now a drive to a more transnational European health union, debates about where competencies and institutional cooperation needs to take place. I think that's welcome. My concern is that we stick to a relative limited approach to health security and surveillance and vaccine rollout, and talking about responding and preparing for new risks. But public health, in a sense, is about existing capacities, and it's also about not only infectious disease risks, but environmental health or social protection issues in general, to make it legitimate. You can only have a decent, essential public health function being accepted by people if it also relates to their needs. And I would argue that the epidemic is only one of the very many health needs that people have. And I'm quite amazed that that this debate about vaccination is not being, that these broader health needs and precarity that really will exist also in the economic recovery after COVID, that has a broader place. So when talking about preparedness and capacity, both within the European Union, both with in relation to the international health regulations, so it's about capacity. It's about capacity to produce and deliver vaccines, but it's also then the systems required to actually deliver them where they're really needed. And the system is as weak as the system is as strong as its weakest links, and the weakest links are at the moment in lower middle income countries, because you talk about a cold chain, you talk about health workers that should deliver it. We talk about a decent financing system that ensure that those vaccines are actually delivered through primary healthcare centers in remote parts of the globe. And we see through existing work with Gavi and with HIV/AIDS, etc., that there are real crucial gaps. And I think for the legitimacy of the EU and the UK, that there needs to be more attention there as well. And through those collaborative mechanisms like COVAX and the Global Fund for HIV/AIDS, etc., there has been cooperation, but the cooperation has been a bit charitable. It was not sustainable and very much depending also on political cycles. So while a lot of people talk about the Millennium Development Goals, about Sustainable Development Goals, universal health coverage, global health security, all those promises that exist, if you would match it with actual commitments, that remains quite limited. So for the EU and the UK, also as part of a more geopolitical approach, I would argue that they need to consider not only the short-term security and economic gains, but also the longer-term engagement to multilateralism and what that would look like. And one crucial element in it, and I think that will really be a changer, and I hope we can discuss, it's the patent regime. One thing that is still at the moment where the EU and also the US are resisting is in a change of the patent regime. There have been calls for a temporary waiver of the TRIPS regime by South Africa and India. The EU and US say, well, at the moment, the flexibility in the regime is such that we can make that work. But the whole argument that quite a lot of public funding and public innovation goes into the private profits of big pharma, while still having a lot of difficulties with rollout, I think that can be a real changer after this pandemic. And if I would hope that leaders take that seriously and also enable a kind of change there. That would be for me a very hopeful outcome of the pandemic. Over to you and for further discussion.
Thank you, Remco. And I think, two main points I take from your speech is really, we tend to look too narrow. We need to take into account this transnational perspective. And also, as you said, that if we look at health, it has implication on intellectual property, on trade, and somehow in between the lines, I think strengthening multilateralism is also a way for the EU to be geopolitically stronger vis-a-vis China or Russia, who also have some vaccines for low and middle income countries that are way more easily available. So I'm now turning to Anna. I think you have both some thoughts to share with us from the perspective of Germany. Germany was or had the presidency also of the EU when COVID happened. So it's quite interesting to look at the position of this country. I was reading recently that Germany wants to speed up vaccinations and follow the example of the UK. But I'm sure you also have given your position and your expertise some reflection also to give on this global health security that has been introduced by Remco. The floor is yours.
Thank you very much, Sarah. So maybe a bit unlike Louise and Remco, I will talk in the beginning very much about the situation in Germany. But I think in the end, I want to make the argument that Germany has a lot of aspirations to be rather strong also in multilateral institutions responding to the pandemic, but it also has a lot on its plate in the country at the moment. And I think it is trying to do like damage control and image repair before maybe then becoming more active again in the multilateral institutions. So when I prepared a little bit for this webinar today, I thought about another webinar that I had participated in December last year. It was a bit similar to the one today, but there were only two panelists, me and Matt Flinders from the University of Sheffield, and we were asked to compare the UK and Germany in terms of their responses to the pandemic. And it was really interesting because my British colleague Matt was full of praise for my country's leader and also full of criticism, I would say maybe even contempt for how his government had responded to the COVID-19 pandemic. And then what happened was that I also gave an input at the beginning, and I was much less enthusiastic about the current situation. I pointed my finger at a longer list of things that in my view had gone seriously wrong, and then the whole conversation kind of developed in an interesting direction. I would definitely say that at the moment, also the German government is very much inward oriented. We have a painstakingly slow rate of vaccination, so no wonder we want to copy the UK model. And we are also observing a rather clueless sequence of strategies that have been proposed. And I personally would conclude that the German government has really kind of gambled away our reputation as a highly efficient country that is not only equipped with a first-class health system, but obviously also, and if we think broader in terms of its role in global health, I mean, its focus, for example, on health equity and on the spread of health systems around the world. I think it's based on this legacy that we have. And I think at the moment we have a bit of a problem with that legacy. Perhaps you remember that famous slogan by one of our automobile firms, Audi, Vorsprung durch Technik, lead by technology, that was once, I think, representing our global image as a thorough, reliable innovator. And I also think that we have a little bit we have damaged that reputation. So in my girls' school, even a year into the pandemic, neither the internet connection nor the digital platform they have can actually cope with multiple video conference. So the teachers have to go home to do the video conferencing because the school is so ill-equipped. And we've already seen in October last year that also our test and trace capacities had reached their limits. So in many of our local health offices, the test results of people actually still had to be communicated by telefax. So this is maybe like a bit of a funny insight here. So we are now right now we are entering a third month of a lockdown with schools still closed for the greater part of pupils. So I think that might also explain where also a lot of the public debate at present really focuses on the situation in Germany. And there is a serious lack of perspective, extreme fatigue and restlessness here in the population, which I believe is poisonous for trust in politics, but also for social coherence and a spirit of solidarity and feeling that we're in this together. And I think it also explains and something that I think Remco has raised, which is that I definitely do not see any kind of, also in the broader public debate, when you watch, I don't know, talk shows in the media, that you have a feeling that there's really kind of a global thinking about this pandemic at the moment, particularly when you look at how people talk about the vaccine. Everybody's concerned that when will I get the vaccine because of the incentives, leisure and travel. But thinking about it in terms of this frame, I'm only safe when all the others are safe, and that we really need also to work with our neighboring countries and low and middle income countries is really very it's inexistent as I feel it. Considering these multiple problems that I just mentioned, and then also the fact that we have a national election in Germany this year, I think it's no wonder that Germany has been very inward oriented in the past couple of months, and that the responsibility of its population enjoys absolute priority. You asked if we see a renationalization trend, and I think what we should ask ourselves, of course, if we ask a question is, was public and global health really that much more international before the COVID-19 pandemic? So with a stronger spirit of solidarity. And that first made me think about the Ebola epidemic in Western Africa in 2014-15, because I think it makes a difference if we need to handle an epidemic in Western Africa, and that we actually managed to fend off, perhaps also because of our low economic interdependencies and also international connections to that continent. So shutting out the economies of the countries hardest hit by the Ebola epidemic in 2014-15 through travel restrictions, etc., was, I think, a rather easy move for an international community. But as Remco already alluded to, the better comparison, of course, is the HIV/AIDS epidemic, which has also hit industrialized countries of the global north first, and then become the pandemic of the global south. And I'm quite sure that none of us would perhaps like to apply our saving lives mantra to the early 2000s, when our governments accepted an absolutely appalling death toll, particularly in sub-Saharan Africa. And obviously that was related to the extreme costs of antiretroviral treatment. I hope that what Remco has said, that he believes that maybe also in the WTO now we will see some movement, but sometimes I also fear that we might see a bit of a similar dynamic in the COVID-19 pandemic. Let me finally say something on Germany's role in multilateral institutions. Without doubt, since Angela Merkel has become Chancellor, Germany has been one of the most faithful supporters of the WHO. I think that's mainly on paper and mainly regarding finances. So the German government has steadily increased its contributions to the WHO. Last year contributed a record 500 million euro to the WHO. And actually 200,000 of these million euro were meant to fill the gaps left by the United States. Germany, I think, has also made it clear that it wants to be a central force in the ongoing WHO reform. It has used its EU presidency in order to work towards an EU position paper on that reform. And we will maybe see all EU health ministers endorse what I call a more transparent, effective, and powerful WHO. So it's just clear that at least rhetorically, Germany wants to be a central actor in these institutions, and it also has on many occasions actually expressed this desire to assume a leading role in the institution, also its future reforms. At the same time, it's interesting. We also linked this in a publication in The Lancet in 2018, I think, where we talked about the circumstance that global health, for example, as an academic subject or as part of university curriculum, enjoys very low priority. So sometimes you also wonder about where are all the people, where are they going to come from, the younger people who will be equipped to maybe fill positions on global health in the EU or the WHO. So yeah, I think I'll leave it to that, and I'm looking forward to the discussion. Thank you.
Thank you very much, Anna. So we've had, I think, a whole panorama of perspective, global health, the EU, from the perspective of Germany. I don't think everything is very positive, unfortunately, but I will leave it to our discussant today, Valsamis Mitsilegas. What are the key takeaways, and where do you want to further the debate? The floor is yours.
Thank you, Sarah. Thank you for inviting me to such an interesting event. I mean, I enjoyed listening to the presentations. And as you mentioned, you and I are members of a task force, a working group set up by our Institute of the Humanities and Social Sciences, with the aim of developing humanities and social sciences thinking in the current COVID debate. And as you mentioned, we have centered our work around the concept of trust in responding to COVID-19. So, and I think the presentations have been really very interesting in informing this thinking. And I would like to share some thoughts on perhaps different levels of trust and how we can conceptualize trust in this context, or if you like, a taxonomy of trust, and we can take it further perhaps in the discussion. So first of all, and what was clear from the presentations, we have the level of trust between the European Union and its member states. And I think that was stated also very prominently in the first presentation. We talked about vaccine nationalism. We also talk a lot now, and in the UK, we have many reports from German press on the inefficiency, if you like, of the Commission in providing Europeans with enough vaccinations. So there is this kind of really level of debate about whether the EU should actually have a more integrated health policy, whether it should be efficient, whether member states, especially the more powerful ones, should go it alone. And for someone like me who has been really an opponent of Brexit and really very concerned about, you know, the direction of travel, this in the UK has given really power, if you like, to those in favor of Brexit, you know, saying that, look, you know, in the UK, we could go it alone, and we really have now, in spite of the big problems in the UK's response in COVID overall, you know, a success, because you know, this has been really a national response with sufficient flexibility. So I think there is an interesting debate there about the EU and member states. Another level, I think, which is of interest and it's kind of hidden sometimes, is the intrastate trust, also within the EU. So, you know, who are the trusted countries? We talk about travel corridors, for example. You know, can we, you know, at the bilateral level, do we trust each other more? We close borders as well. That's something I think that it's worth thinking about in the responses. So, you know, you have unilateral border closures, arguably, and Sarah, I'm sure, has a lot to say about this, arguably contrary to the Schengen acquis, you know, in Europe's area of freedom, security, and justice, and in the internal market. So, you know, so there is this also, how does intra-EU member state trust play? And then a number of you also focused, of course, on the global. So, you know, what is the position of individual member states and the European Union towards the world? I mean, do we really need a global policy? Can actually third states, the developing world, trust us? You know, will we deliver? You know, what is really the commitment, if you like, of Europe, both as an organization, as individual states, towards the rest of the world? I want to flag up two further dimensions of trust, which are, I think, important, and they are central to the debate. The first one is trust between states or the EU on the one hand, and of course, private companies. And, you know, we have had this tug of war between the Commission and AstraZeneca regarding the delivery of vaccines. And I think that that's very interesting. So, you know, what is the responsibility of the private sector? You know, we heard about contracts, you know, and what kind of clauses we have in various contracts to protect the EU or states. But I think this is key, because I think a key provider of the COVID response is the private sector, really, is the pharmaceuticals. And I think this cannot be ignored in a non-state centralized system where, you know, this is key. And I think this is a dimension, I think, that is worth exploring further. The final point, I think, but again, that's really central, is trust between citizens and the state. And I think that this cuts both ways. The first one is, of course, trust from the citizens to both the capacity of the state to deliver, to address COVID, and we see with vaccinations also, you know, a lot of debate on vaccine skepticism or you know, vaccine, if you like, negation by members of the public. So, you know, trust by the public to the ability of the states to respond, and that's trust also towards the polity and the capacity of politicians to solve problems, which I think is really crucial, but also trust in science as disseminated, if you like, or projected by the state. But there is, I think, the counter also dimension of that, which is trust of the state towards the citizens. And I think there is this very lively discussion currently about vaccine passports, which seem, you know, prima facie to everyone who has been vaccinated and wants a holiday in the sun, you know, really the solution. But it raises huge issues on equality before the law, surveillance, and a lot of ethical issues about categorizing people on the basis of health data. So, you know, and this is the other way. So who is the trusted citizen who is really trusted to move to another state or to board an airplane? And that is, I think, is not going to go away. I think that there we have really issues of perhaps normalizing situations which would have been really unthinkable before COVID. I'll stop here, but I very much look forward to our discussion.
Thank you very much, Valsalmis. I think you've raised and just presented this issue of trust across very interesting levels. And yes, I think on your last point with towards citizens. It also has also to do with, you know, civic duties, and we see variation of responses across EU member states, and how citizens have been also asked to respect and to respond to social distancing rules and so on. So yes, that maybe calls us to rethink a little bit the social contract between states and citizens as well, in terms of rights and obligations. At least the pandemic will have a lasting, I think, effect on that. But I'm happy to take maybe, again, in the order of the panel, a few minutes of reactions, maybe to each other talks, or maybe to the points that were raised by Valsamis. And I'm asking also the participants in the audience to please start typing in your questions, if you have any, in the chat. If you can put your first name as well, that would be useful for me as well. So you have a couple of minutes to enter your question in the chat. Louise, would you like to pick and choose which aspects you found most relevant from your perspective?
Yeah, a few things. I think also in relation to what Anna has said, and it also relates to the issue of trust. So also here in the Netherlands, we have elections on the 17th of March, with people already being allowed to vote from the 15th and 16th onwards. And what has surprised me so much is also that in the Netherlands, has been a huge debate about how the weaknesses of the national response, whether the measures were appropriate, the testing capacities, the super slow rollout of the vaccines. Now I think we're doing a bit better again, but the Netherlands was really slow with getting up to speed with the vaccination. So, and it surprised me that in Germany you saw a debate emerging criticizing the European Union. I think in the Netherlands people didn't even realize that the EU had purchased the vaccines for them, because they were so preoccupied with complaining about the health minister and the national mistakes being made in the policies. Now I think they know it, after, of course, the open row with AstraZeneca, which also took some attention in the Netherlands. But we didn't see a lot of discussion on this in the debate. I just saw on the news that one of the, let's say, opposition or more nationalistic-oriented anti-EU leaders, Thierry Baudet, so we have two, we have Geert Wilders and we have Thierry Baudet, has now actually acknowledged that COVID is probably not made by an culprit to kind of poison the world, which I think is already a good sign, because we also see a rise in the Netherlands, like in other countries, of people who think that the COVID response is also a way, to domesticate or to tranquilize citizens. And this is, it's just a small fraction, of course, of the population. But yeah, the anti-vaxxers, the discussion about the policies being disappropriate. And in the Netherlands, we had a huge debate about the curfew, and also a law case that first the judges said that the curfew was not based on lawful grounds, and then in a higher appeal, this was rejected again in favor of the government policy. So there is quite a bit of unrest and also protests in the weekends, like in Germany as well. But I think that's really interesting. What I find interesting is that I can fully see all the different levels of trust that you outlined, Professor Mitslegat. What I still didn't notice, and which I also don't witness so much in society, is the distrust against big pharma, fortunately, I guess, but also maybe a discussion about, let's say, how to deal with these big and powerful companies. Whereas we have seen this with other big multilaterals, because when the current government started in the Netherlands, there were a couple of other issues, such as tax benefits for big multinationals and other issues, which led to a big debate in societies. And this is not what we have witnessed so far with the pharmaceuticals. So I think that's interesting. So yeah, I recognize very much the citizens versus the state, even being more dominant than the anti-IE EU stance on this issue. Yeah, I think that's also a good lens, let's say, to look at this issue, this aggravation of distrust. Perhaps to add, and that's just a question mark for me, I'm also a bit afraid how this disease is going to affect our society in some sense of distrusting each other, because people get so used now in society to take distance from each other. You also see more, I don't know, in society, I guess, irritations. So I'm wondering, let's say, how we will be able to glue together our societies in the future. Let's hope, because also scientists are diverging on whether we can actually really get rid of COVID or whether it will become a manageable disease in the future, hopefully. And then every 2 years you get your other vaccine for the new variants that have emerged somewhere across the globe. But how do will we be able to get back to a normal society in which you can have mass meetings, for instance, or will we always take a bit more distance from each other, wash your hands? And what does this also mean for segmentation in society? Or anyway, so, but it's not my actual field of research, but it is something that I can witness in society, and that I'm also concerned about how this is going to evolve in the future.
Thank you very much. It's a very valid point, and I mean, I work on migration, and definitely, I think as vulnerable populations, you see how social distancing is affecting hugely also help and contacts with migrants and refugees, and also policies. Moving to Remco, would you like to react to the discussion and the points made by the discussant?
Yeah, when it's about the social contract and trust and legitimacy, it's what we've seen in global health is this whole securitization of health. It's part of this securitization of society as a whole, dealing with risk. It's a little bit the global risk society, as Beck explained it. And in a sense, is one thing that happened with Ebola, for instance, that there were international mechanisms also, that there were insurance schemes being set up that would be triggered once a new pandemic would emerge. Eventually, this has not really worked, but people are very much thinking into mitigating risks as a way of dealing with society. And the question is then who is part of that society and who not? Who is part of such a social contract? And what does that say in relation to trust towards the state and also the international regime? And what I find intriguing is that we approach health so much individually now as a lifestyle issue, as something that we can individually control and that we can individually manage, while history shows us that health risks and pandemics have been very prominent. And what is peculiar this time is that before we probably had more communal ways to deal with it, whether it's religion or whether there was more perhaps trust in authorities during war times, etc., just after the First World War with the Spanish flu. And now, so it is for me a moment that it's also it will redefine a little bit how we relate with each other. And I don't think that there's a way back to a normal that was there before the pandemic. There will be a new situation where we need to relate with each other, but also realizing that we can't keep all those risks out. Risks are part of life, and COVID will be part. It will be an endemic disease like measles and HIV and malaria. So we can't eradicate it. And I think that still has to sink in very much. And once that sink in, I think also international cooperation within the EU and at the state level will be easier.
Thank you. I'm turning now to Professor Olscheiter.
Thank you, Sarah. I think a lot has been said already, and I found all this taxonomy of trust also very intriguing. So I think I'll add something to that. I'll be brief. So I wanted to say, to respond to Remco, like I think your last thought on the individualization of health as a lifestyle. Perhaps, I don't know if you've observed it, but we're also having this really absurd debate or development in Germany, where a lot of people don't want to accept the AstraZeneca vaccine because they consider it like a second-class vaccine. And anyway, they don't trust that vaccine, also because of all the history with the negotiations and how it then eventually got to Germany. So, but I often think about this as an absolutely weird kind of side effect maybe of this individualization of health. So I think the companies that produce our medicines, they actually live from this. Like I can go to the pharmacy and buy 10 different products that have the same kind of ingredient, like ibuprofen, for example. And I think it's an effect of that. Like I want to have a choice. I now even want to choose my vaccine. I never actually remember when I asked my doctor about what is this stuff that you're injecting into my arm. So I didn't even look at it. But that's just like some add-on to Remco's thought. And then on trust, I mean, so maybe Louise, it will resonate with Louise when you approach this from an international relations theory angle, then you'd say, okay, trust is a soft constructivist concept. You could maybe add it to friendship, or I don't know, international cooperation that comes out of continued and trusted relationships with other countries. And then I'm very much a constructivist at heart, but then when you said it, I realized that, for example, interest rate trust, there I thought, I see the more realist picture of a lot of interdependence too. So, for example, the Czech Republic is very much in the spotlight now for its total loss of control over the pandemic. At the same time, it borders the region in Germany where we have the biggest issues, which is Saxonia, Sachsen-Anhalt. Health systems in these federal states of Germany would just be crushed if the health workforce coming through the Czech Republic or from the Czech Republic wouldn't be allowed to enter the country any longer. So I think particularly in Europe, where countries are small and there is so much also labor migration, and that's maybe why I'm a big fan of the no COVID thinking, but maybe not so convinced of the realizability of these kind of green zones, and that are the things that then actually maybe make me want to say maybe it's not trust, but it's really kind of hard interdependence. And for the rest, I think Louise has said it all. I think similar things are happening in Germany too, in terms of trust of the state towards their citizens, trust between citizens is really a big issue. And I also personally think that the German government has also done like a terrible political communication, particularly with groups, I would say young people, women, the elderly. They haven't included at all in their communication. And I think this is, I mean, particularly with young people, I think if you want to build trust, this is the group you have to start with. They're your future voters, and you're like, I don't know. So, but that's very much a German perspective, maybe.
Thank you very much to all of you for all your input. I'm not sure, Valsimis, if you have one word that you want to add. I've asked attendees to type in their questions in the chat, but I don't see any for the moment. So please, I think you have three quite high-level experts on the topics that we have discussed. So I give maybe a couple of more minutes, but in case there is no further reaction, maybe it's social distancing is impacting all of us. I think what I would like to hear, maybe as a way of, let's say, wrapping up a little bit the conversation from each of you, is what do you think would be your main policy recommendation at the moment, if we think forward? Because we have, I mean, I think Anna, you raised the terrible communication. I think Louise raised a series of issues at EU level, and we wonder, some have even raised the question, I think, Valsamis, if further integration in the field of health was a good thing or not when we look at the UK experience, for instance. So do you have any, if you would have to, I don't know, whoever you would like to advise, WHO or EU or German officials, but what do you think would be your main key takeaway message for policymakers, wherever you want to provide some advice? So I don't know, we can go in different order if anyone has an idea where the key focus should be. Louise, would you like to, what do you think in terms of EU institutions and in terms of integration, for instance, on the health issue, because that's really your expertise? What would be your main message?
Yeah, just one small thing. It's I said there is not so much distrust yet against the big pharma, but apparently so in Germany there is with AstraZeneca. This has not spread, I think, in that similar ways to the Netherlands. I saw some discussion about the AstraZeneca, but I don't think it has affected, let's say, people's views on the vaccine as of yet. So that's a notable difference, and also that shows that there is still different public discourses in the different EU member states. I think my advice would be for the EU not to be too much intimidated by criticism on being bureaucratic and slow, and just to point out that the whole affair has also showed that you have to be prudent and careful when negotiating advance purchase agreement with pharmaceutical companies. And if the EU would have allowed, let's say, too high prices, it would also not have been good for the EU's taxpayers, because it will not only be the prices of today's vaccines, but probably also the guideline for the prices of the vaccines of the future for all the new variants. And this is just the start of a process. So that's one thing. And the other thing is that I would also not shy away too much from, let's say, member states who are lukewarm or openly opposing competence expansion. I think the real difficulty with health competence expansion is that indeed these health systems of the member states are so different and the financing is so different. So that's the practical difficulty I see is really problematic. I've also seen in research that if you change something on the competences, then member states will fiercely resist. But once the decision is taken, usually after 5 years, nobody remembers. So I would not be too much afraid of that, let's say, legal discussion. But I guess the real tough issue is to identify where the areas are where more joint EU action is needed. And I think the purchasing of medicine also beyond the COVID-19 vaccine could be one, because I think that's where you need more market power. And it's also related to the discussion about having more medicine production capacities in the EU in relation to your strategic autonomy and positioning in the world. So it makes sense also from that perspective to consider that issue. So really to be more a forceful, big entity of consumers operating on this health market, if you like. Yeah.
Thank you, Louise. And I think in a way you answered the question in the chat, which is the following. Do you see any indications of hesitancy among or conflicting interests between EU member states when it comes to supporting the joint procurement of vaccination at EU level? I think we have covered, but maybe you want to complete.
So I think it's also related to the trust. So the EU member states think that they have different interest when purchasing medicines. I don't know, in the Netherlands, they probably think that the French and the Italians are more keen to buy medicine because they use also a little bit more medicine in their health systems than the Dutch do. But I think such, let's say, arguments should be subjected to the overall objective that if you purchase for a larger number of consumers, you have way more market powers to bargain a lower price and to get better deals for the patients in the European market. Yeah.
Yeah.
But yeah, there are hesitations with the member states, and they also are not yet convinced that the Commission is able to do it, because the health officials within the European Commission are also indeed very limited, as also Anna says, the knowledge and the expertise in this field, connecting also health expertise to European integration expertise, for instance, is still relatively limited.
Yeah. Thank you very much. Remco, final word?
Yes, and it relates not so much to the vaccination per se, but to the response, because I think that what this pandemic shows that we have reached a real bottom as well about how far state capacity for public services can be eroded. There's a whole political and macroeconomic policy approach over the last 20, 30 years that has also eroded all these public health capacities. And I guess we'll see a return of more public investment and return into public essential functions. At least I hope. This is what, for instance, Marina Mazzucato is also arguing for. But that's if we don't take a more, let's say, what they call a pluriform, a more heterodox economic approach to recovery, where we pay for jobs in the healthcare sector, where we try to debate about how we'll keep essential public health functions financed. If we don't do that, then I think that distrust will continue. So I do absolutely hope that also the fiscal space and macroeconomic considerations are being taken serious here.
Okay, thank you very much. Anna?
Yeah, I think maybe have 2 to 3 policy recommendations to add to that. So I think one maybe very obvious thing is that I would strengthen the authority of the WHO, maybe through another revision of the international health regulations, where it has even more power to investigate cases that could turn into global health emergencies, public health emergencies of international concern, the FIC. So I think one suggestion is, and I also know that it could be also risky, that it can investigate also on the basis of social media reporting, totally outside of the official reporting by member states themselves. Because I think now, and in the past, this has always or very often been an issue, that the communication of certain incidences wasn't just quick enough and not transparent enough. So that's one thing. And then the other two is that I said it already, that I think global health education should be really strengthened. Louise also said it. I think we just need more experts on that. Before that all started, I think, honestly, in Germany, there were maybe 3 to 4 people, 2 professors and a couple of more coming with a political science, international relations background, working on that. And people always told me, like, it's such a niche subject, etc. And now, of course, I think, like, okay, I told you so. So that's one thing. And then the maybe the broadest thing is that I think there is so much interest for politics now, because it's like a very narrow issue, but I think many people now have really an interest in how politics works, also with the pharmaceutical industry, but also in the country. And I think governments should really capitalize on that. So all my family, everybody, my friends, they all of a sudden they're interested in the stuff that I do and ask me questions. And maybe that's also a good moment for, like, not only telling them, yeah, politics is always about finding solutions, but also telling them about how difficult it is to find solutions when you have so many kind of competing interests, and everybody says, yeah, but my rights, and my special needs and my special situation, that it's really a value and norm conflicts that you have to resolve. And that's tedious, and that explains sometimes also why it's slower than you would expect it. But I think that would be a good moment now.
Okay. Balsamis, do you want a final word, maybe?
I'm not sure whether a final word, but just a point. I also related again to trust, and I think Anna mentioned this earlier. I would also, it is a brave choice, but I would also strengthen the focus on interdependence in terms of communication and education and dialogue with the public, because currently I think you can see COVID as a test case also for the teething problems of the EU as to how to communicate itself. So are there common solutions? How much do we depend on each other? In a sense, we need to be honest about this, because currently in parts of the debate, it's that all of this is purely national. It can be contained by individual member states with their individual measures. And we know that this is not true. So a bit more honesty and openness about the fact that we depend on each other, both in Europe and globally, that there is also a public-private interdependence. I mean, we talked about the pharmaceuticals, for example. We need to accept that if you're not China, the private sector will play a role with all its flaws and, of course, open to critique. But, this is a partnership. And, I think a lot of this has been under-discussed and, it remains on the surface. And I think that also erodes trust. So I would say, let's think of a more joined up debate, I think, in all of that.
Yeah, thank you very much. I think it's been a really rich discussion. We've covered a lot of ground. And indeed, I mean, I think this whole discussion should lead us to rethink what we have long studied in politics, such as the democratic deficit. We've talked about legitimacy and what it means. And I think because it's about interdependence and individuals, it also brings us to this idea I'm very keen to research at the moment, which is what it means everyday Europe as well. So the more quotidian, the more daily aspects of Europe. And I think COVID-19, in a way, it's about politics at the top, but also politics at the bottom. And it brings us also in that direction. So I've learned a lot. Thank you to all of you. Yes, I hope we continue this discussion of a future webinar. Thank you.